Guillain-Barré Syndrome. An overview. Guillain-Barré, pronounced Guillain-Barré Syndrome, is a rare but serious neurological disorder in which the body's immune system mistakenly attacks part of its peripheral nervous system, the network of nerves located outside of the brain and spinal cord. This attack damages the nerves, causing muscle weakness, numbness, tingling, and in severe cases, paralysis. GBS can affect anyone at any age, but it is more common in adults and older people. Most people make a full recovery, but it can be a long and challenging process. Key characteristics: autoimmune disorder. The body's own immune system causes the damage. Rapid onset. Symptoms typically develop quickly over hours, days, or a few weeks. Ascending weakness. The classic sign is weakness and tingling that starts in the feet and legs and spreads upwards to the arms and upper body. Medical emergency. GBS is considered a medical emergency because the weakness can affect breathing muscles, requiring hospitalization and sometimes a ventilator. Causes and triggers. The exact cause of GBS is unknown. However, it often develops shortly after a viral or bacterial infection. It is believed that the infection triggers an abnormal immune response. The immune system, geared up to fight the invading organism, gets confused and attacks the body's own nerves, a phenomenon called molecular mimicry. Common triggers include bacterial infection. Campylobacter jejuni, a bacteria often found in undercooked poultry, is the most common trigger, accounting for about 30% of cases. Viral infections. Influenza virus, the flu. Cytomegalovirus, CMV. Epstein-Barr virus, mononucleosis. Zika virus. Hepatitis viruses. COVID-19, SARS-CoV-2. Other triggers, rare. Surgery, trauma, and very rarely vaccinations. It's important to note that the risk of developing GBS after an infection, like the flu, is significantly higher than after a vaccination. Symptoms. The symptoms of GBS can progress rapidly. They often include initial symptoms: tingling, pins and needle sensations, paresthesia, or numbness, usually starting in the toes and feet. Muscle weakness in the legs that spreads to the upper body, ascending paralysis. Progressing symptoms: difficulty walking or climbing stairs. Loss of deep tendon reflexes, for example, the knee-jerk reflex. Severe, deep muscle pain, which can feel achy, crampy, or sharp. Weakness in facial muscles, affecting eye movement, speaking, chewing, or swallowing. Severe, life-threatening symptoms. Breathing difficulties. Weakness of the diaphragm and chest muscles can lead to respiratory failure. About 30% of patients require mechanical ventilation. Autonomic dysfunction. The nerves controlling involuntary functions can be affected, leading to fluctuations in blood pressure, either very high or very low. Abnormal heart rhythms, arrhythmias. Problems with digestion, bladder control, or sweating. Types of GBS. The most common form is acute inflammatory demyelinating polyneuropathy, AIDP, where the immune system attacks the myelin sheath, the protective covering of the nerves. Other variants include acute motor axonal neuropathy, AMAN, which attacks the nerve axon itself rather than the myelin. It causes pure muscle weakness without sensory symptoms. Acute motor sensory axonal neuropathy, AMSAN, a more severe form that damages both motor and sensory axons. Miller-Fisher syndrome, MFS, is a rare variant characterized by a unique triad of symptoms: paralysis of the eye muscles, ophthalmoplegia, poor coordination and balance, ataxia, and loss of reflexes, areflexia. Diagnosis. Diagnosing GBS is based on symptoms and a series of tests to rule out other conditions.
A physical and neurological exam, doctors check for muscle weakness, loss of reflexes, and the characteristic pattern of symptoms. Lumbar puncture or spinal tap. A sample of cerebrospinal fluid, CSF, is taken from the lower back. In GBS, the fluid typically shows high levels of protein with a normal white blood cell count. This is known as albuminocytological dissociation. Nerve conduction studies and electromyography, EMG. These tests measure nerve activity. In GBS, they show that electrical signals are traveling much slower along the nerves, confirming nerve damage. Treatment. There is no cure for GBS, but treatments can reduce the severity of the illness and speed up the recovery. Treatment focuses on managing symptoms and supporting the body's functions. Immunotherapy. Plasma exchange, plasmapheresis. The patient's blood is removed. The liquid part, plasma, containing the harmful antibodies, is separated and discarded, and the blood cells are returned to the body with a plasma substitute. Intravenous immunoglobulin, or IVIG. The patient receives high doses of immunoglobulin, antibodies from healthy donors, through an IV. These healthy antibodies help block the damaging antibodies causing the attack. Supportive care, crucial. Hospitalization, often in an intensive care unit, ICU, to monitor breathing, heart rate, and blood pressure. Mechanical ventilation if breathing muscles become too weak. Pain medication to manage severe nerve pain. Physical and occupational therapy to maintain muscle strength and prevent complications like blood clots and pressure sores. Prognosis and recovery. Recovery from GBS can be slow and varies from person to person. Recovery. Most people, around 70 to 75%, make a good to full recovery, though it can take months or even years. The recovery phase begins after the symptoms plateau, which is usually within 4 weeks of onset. Residual effects. About 20 to 30% of people are left with some long-term effects, such as persistent weakness, numbness, or pain. Fatigue is a very common and long-lasting symptom. Rehabilitation, including physical, occupational, and speech therapy, is a critical part of the recovery process. Disclaimer: this information is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you suspect you or someone else has Guillain-Barré Syndrome, seek immediate medical attention as it is a medical emergency.